Hello and welcome. This is Deepak Mishra and you are watching Dominance International. Today in this video, I'm going to compare and contrast the features of or the option of post-graduation in Germany and that with the post-graduation in UK. Basically, it is not about the training program or the quality of training, all those things, but the other things that also is also considered during these choices. The most of the content of this video is from one of our viewers who has taken the effort and done his research between UK and Germany and has sent me his research and seeks my opinion on that. So I thought, okay, I told him that I'll make a video using his content, and he did not seem to mind that. And I thought maybe I should take that content and share it with other candidates and give my opinion or my perspective on that research that he has done or the information that he has assembled. All right. So considering first thing that he has talked about is the higher tax system. In Germany, the taxes are around 40% for the beginner, for a single person, like 42%. And in UK, it is little lower. It's around 25 to 27, 30% like that. So the tax is and as you all know that the tax is the biggest expense that salaried people have. Taxes are the biggest expense that one cannot circumvent. One has to try to get away from these things, these taxes in a legal way. But for most of the people, because of not so great financial acumen, we are not able to circumvent that. We end up paying lots of taxes. Taxes are your biggest expenses. This I have learned from the financial things that I try to learn. All right. So second point that he has mentioned was UK is costlier than Germany. So see, I would say it's not that different. The cost of living in UK is not very different of that in Germany. It might be slightly 2%, 3%, but not very significantly. So if the cost of living is almost the same, that you can assume. Important thing is that the next point was the language barrier. That okay, in UK people speak English, so you have learned English since your kindergarten, and you have you are quite fluent in English, quite comfortable. You have studied entire medicine in English, so at workplace and in private life, you are very confident in English language. You can contribute, you can be part of the team, you can socialize, you can make friends with native speakers. So that is a positive thing. That is a very significant positive that people have, in England, in UK, and that in Germany, that is a real negative, real hindrance, because you have to break that glass ceiling. You have to you are not, even after living for a few years here, even though with your language you can do all your work and everything, but still the socializing, when you go to some place, some restaurant, some with your native speaker friends, so you have to put an effort to understand the conversations that are going on, the jokes that they make, the cultural symbolism that they use sometimes. So those things, to understand those things, it takes time. That is why this point is very valid, that English speaking country, your life is little easier. That I have been mentioning in many of my videos, that okay, English speaking country, your life will be easier. Yeah. The next point he's talked about is that and when I talk about the easier side, that okay, English speaking country, your life is easier, but on the bureaucratic side, then the hurdles are much higher. In Germany, you get, as a doctor, you get a blue card. As soon as you have your job contract, you get a residence permit, and after 21 months, you get a permanent blue card, that is unbefristet Aufenthaltserlaubnis, that is Niederlassungserlaubnis. And after 7 years, you get a citizenship in Germany. And with that citizenship, you can live and work in entire European Union. So yeah, that is a very huge benefit, huge advantage of working in Germany in compared to UK, where you have to wait for that matter in US, where you have to wait for years to get like a green card, or in UK your visa has to be extended every time, and citizenship is very difficult in those English speaking countries. So that is one huge benefit about Germany. Then he's talked about salary. The salary is little higher. He has written salary is little higher in UK. Yeah, But then see, I would say about salary thing, salary is almost the same. What people go is through statistics, that okay, this research shows this much salary, this one shows that much salary, but overall salary becomes the same. You have, depending upon what kind of works you do, like do you just work in the hospital, or do you do extra duties, do you do duty at another place as well, some part-time duties like that. So that way you can, plus like for example, I know more about Germany. So here, if you are doing Kaufdienst means the Hausarztpraxis, that's a GP practice, that is only till evening, like till 7 o'clock, till 5 o'clock or something like that. But officially it has to be open till 10 o'clock. So in Dienst, in this time, that duty, that 5 hours or 4 hours has to be given to somebody who will do that duty. And most senior people, like people who run that practice like the entire day and 5 days a week, do not have that interest to sit at in the evening also until like 10 o'clock. So they don't have that interest, so they give it to younger people. So there you just need some contacts and all, and like contacts as in you have to show that okay, you want to do it, you have to talk to people that okay, I want to do it. So these things are all also easily available, but obviously you need to have some experience, like you have to be at least third, fourth year resident who has seen some cases, who knows things, who can manage patients. They are not emergency, there are Hausarztpraxis, there is GP practices where they need a doctor who will treat cough and cold and fever and all those things. So person who not emergency will go to the hospital. Okay, so such duties are also paid like 80 euros or 100 euros per hour. So in that case, like a friend of mine who is recently has begun doing this Kaufdienst, so when he does like 12 hours such duties, he walks home with 1,000 euros in hand. So, and they are also less taxed. Those that money is also less taxed. So money wise, you can work like depending on, there are many options, many opportunities even in Germany. About UK, I think there must be same in UK as well, the locum doctor system and all, but that is also there in Germany. When you work as honorar arts, there you get paid 100 euros or 80 euros per hour brutto. That obviously taxes will be reduced from that. So the earning Möglichkeit, the earning opportunities are quite significant both ways. So there you don't have to worry. I mean, obviously you won't earn like the doctors in US earn. So you won't earn like that, because in US, like the hospital duty, the normal hospital duty that they do after residency, like art consultant position, they earn significantly higher than what people earn normally in Germany. Obviously here they have to do that extra duties and everything to match those salary in the US. All right. So the next thing was about private practice. That apparently here the candidate who has sent this is little misinformed about the private practice system in Germany, or because of the language barrier, he thinks that the language in Germany, because of the language barrier, you will not be preferred, or you will not be able to develop your own private practice. It is not so. It is not so. You have to be good. I mean, obviously, see, you will run your own practice, or you will start your own practice after becoming Facharzt. Facharzt will take 5, 6, 7 years. Okay, so after, or maybe you will work couple of years after becoming Facharzt to gain more experience, to settle in that area. So after that much time, after 6, 7 years down the line, living here and talking to people, working in hospital, your language will become that good that you will be able to take care of patients, and patients also ignore your language after a point. After a point, they see how you behave, how you diagnose them, how you help them, and then your grammatical errors and your accent is ignored by them. That is by experience, I can tell you that they will, if you are nice to them, if you help them, if you take care of them, they will ignore your accent, they will ignore skin of your color, like color of your skin, sorry. And yeah, so about that thing, you don't have to worry. In UK, it might be easier, but here also it's not difficult to start your own practice. Many foreign doctors have done that and done that successfully. So yeah, and in private practice, like the money wise, the income wise, private practice, both places, it is more bureaucracy, more work. But then it is a business basically. Right, so business involves your involvement, your work and everything, and if you focus on that, then you can be a successful practitioner. I mean, there is no reason why not, unless you have not studied medicine, and like, so in that case, I mean, nobody can say. But then if you are okay per type of person, and you're passionate about medicine, then and you like taking care of people, helping them out, then definitely, then why not? Okay, the next doubt was the next the query was about the social circle that I've already covered actually. That social circle will be better in English speaking world where you can speak the language fluently compared to that in Germany. And third thing, the last thing was about the Indian diaspora, or the diaspora from subcontinent. A lot of we know that since England came to India and ruled India for 400 years, when they left, we did not let them go alone. We went with them. And now there are towns in or places in UK where you see more colored people than than the natives. So that is historically the case. Everybody went to UK, and that is why it has become so international. In Germany, it has not been so far. I mean, obviously, there are some places which is flooded with Turkish people, some places filled with Arabic people. So places are like that. So that should not be a matter of your concern, because you have talked about, like this doctor has talked about immigrant population. Immigrant population has sometimes benefits, sometimes difficulties that people face in such areas. But that is everywhere. That is everywhere. That you cannot. That could not be a reason. That cannot be a reason to choose, like to make to be considered during making a choice. All right. And about a number of Indian people, it is in UK obviously it is higher, but in Germany also it is significantly there. It's not like in Germany there is no Indians. Obviously in smaller cities there are no Indians, but then that would be the case also in UK, I guess, because there also people are flooded, or in big cities, and nobody lives or wants to live in smaller towns and smaller places. And doctors, for beginning, they have to begin with smaller places. So in Germany, you have to assume that, okay, in first couple of years you will be starting at a smaller hospital, smaller town, and there you will not have many people from your home country. But then later on, when you progress, when you move to bigger city and bigger hospital, then definitely you will come across different people, and you can socialize and everything. So that with this, I think I have talked about the factors that this doctor he's from AIMS Raipur. He has talked, tried to share with me. Most of his research is correct, and some points which are like that. So again, the question was, which one should one choose? Question is once again that, okay, these are the things that he knew already. The thing is that how to choose, what to choose. Here comes the statement which I have said many times, that if you want to choose medical branches, internal medicine, pediatrics, go to UK. Sit for PLAB, take the English exam that they have, this occupational English test, and then you sit for PLAB, you take the steps, you go there. But then and you can get into residency over there. Yeah. So, and if you are interested in surgical branches, then I would suggest not to think about the difficulties that you will have difficulties because of the language and the cultural difference. In Germany, you will definitely have difficulty, but I would suggest ignore that, or not ignore that, but accept that, okay, it will be difficult, the path is difficult, you have to be persistent, you have to sustain that thing, and then then that way you can get into surgery, and you can become fakats in your branch, and then later on you can also start your private practice. So the answer is clear. Both have pros and cons. If you are interested in medical branches, go to UK. If you're interested in surgical branches, go to Germany. That is the crux of the matter. All right then, thank you very much, and I thank this doctor from AIMS Raipur who has taken the effort to do such research and send it to me. I hope his research through my channel has reached at least hundreds or maybe a couple of thousand people, and they all will be benefited through his research. All right then, thank you, bye bye.